So why concern ourselves with history and philosophy? It's because worldviews find their way into public policy. We need to know how people think. If we understand how people think, we can predict what they will think and then what they will do. So it's interesting, since the Patient Protection Affordable Care Act has been passed, there's a survey just released last February. So they asked the questions, is healthcare reform likely to lead you to retire over the next 5 years? This is a physician survey, okay? So we're talking about, as we're bringing about 30 million new people into the system, what are physicians going to do? Said it's 23.7%. Said it's very likely I'm going to leave medicine within the next 5 years. Another 19% say it's somewhat likely. So there's about 43% of physicians thinking about leaving medicine in the next 5 years as a result of the Patient Protection and Affordable Care Act. Even if half that number actually left, we're left with a huge physician shortage. And right now it's hard for patients, especially seniors, to find access to physicians. A second question they asked is, are you willing, again this is to physicians, are you willing to recommend healthcare as a profession? 9 out of 10 physicians are now telling their kids, telling their friends, stay out of medicine, don't do it. So there's been a fundamental transformation in what it means to be a physician. It used to be that physicians would encourage their kids to go into medicine. You'd see a physician encourage his son or daughter to pick up the practice of medicine, and in turn they would encourage their sons and daughters to go into medicine. So you'd see physicians 3rd and 4th generation caring for their patients. That's changed. Physicians are saying, it's time to find something else. And it's not so uncommon that I hear the question, how are you going to escape? When our physicians are looking to leave the practice of medicine, it's a system that's ready to implode. So the question comes, is there another way forward? If this system is not working, is there another way forward? Well, I was asked by one of the presidential campaigns to write a plan for healthcare reform for the United States. I wrote the first part in this paper, Cutting the Gordian Knot, a patient-centered, fiscally responsible plan for healthcare reform. And I won't take time this morning to run through all the policy details. That would be too much punishment for a morning like this. But I'll run through 5 guiding principles. First is craft a series of reforms, each addressing one clearly identified problem in the current system. Prior to healthcare, I used to be in electrical engineering, and when I was working on a circuit board, I'd never change 50 inputs and have any prayer of understanding what happened to the system. I'd change one input at a time, and then watch the outputs. Change a second input, watch the outputs. As you approach a complex system, this is the sort of decision-making process you have to go through to fix that system. And healthcare is simply a complex system. So we address one identified problem at a time, not 2,700 pages. Pass each reform separately. Write each bill using a clean and understandable format and keep it to a reasonable length. These are just sort of common sense ideas. Keep each bill clean, letting it pass or fail on its own merit. No pork, no payoffs. And lastly, make the final language available to the citizenship for 7 days prior to voting. And then I go through and list 17 specific reforms, starting with block grants for Medicaid for the states. That idea alone could save somewhere around $300+ billion, enough to pay for the cut coming to seniors. There's approximately 30% physician reimbursement cut coming for seniors next January. And unless we reverse that cut and find money to do it with, seniors are going to be in an awful lot of trouble, as are physicians. So if you want to get more of these ideas, you can find this paper, Physicians for Reform, or the Cutting the Gordian Knot, on the website, physiciansforreform.org. So physiciansforreform.org, and you can download a PDF for free of this plan. And then what got me into all this was a book I was working on. It's The Battle for America's Soul, Healthcare, the Culture War, and the Future of Freedom. And you can also order that online for a donation to Physicians for Reform. And what I do in the book is I started talking about healthcare, and then develop this battle of worldviews, and then show why healthcare is just the beginning of the problem. This is affecting education. It's affecting the rule of law in our courts. It's affecting foreign policy. It's also affecting politics as postmodern thought enters the political realm. So I want to thank you for your time this morning. And again, I appreciate that. And I'll end here for some Q&A. And I think we can end now in
one question.
One question,
Yes.
sir.
Yes, I mean, there are going to be shortages, for example, of kidneys. There are not enough kidneys to go around. Somehow there has to be a mechanism to assign them to people.
Mhm.
And what, are you going to give a kidney to a 90-year-old because he's the first one on the list? Or somebody who's 15 years old and is otherwise good health and is probably going to live for 50 years? So these decisions will get made, whether it's by Hippocrates or the other guy, and there are real shortages that can't be dealt with by the more money here, more money there. There's just so much you can do.
You're conflating two issues.
Okay.
And the one is a triage question. And the same thing if an ambulance gets to the roadside and there's one person, or the battlefield is really where it comes from. You've got one or two people and several folks that need taken care of. You have to start to pay. That's a triage question we have to deal with in medicine all the time. But what it's conflating is there are ways to improve our system. Just Medicaid block grants, for instance. There's a way to restructure Medicaid that can save hundreds of billions of dollars. So it's not saying you do get, you don't get, or this one does, that one doesn't. But by making the system more efficient, we can save enough money. We don't have to resort to a government-centered ration program. So, and that's what I lay out in my paper. Well, thank you so much for your time.